So thank you for joining us today, and we hope you'll join us tomorrow. But now we're going to jump right ahead to talking about building vaccine confidence through trusted messengers using vaccine champions and Houseworks. And Houseworks is a private duty, it's actually a huge independent private duty home care agency based in Massachusetts. They hire caregivers, just like all of you, to work with seniors in their homes and in facilities. And they were able to achieve, at last count, more than 70% COVID vaccination coverage. I think it might be higher by now. Joining us today to talk about Houseworks is Andrea Cohen. She's the founder and vice chair of Houseworks and has rapidly become one of my favorite people. She is an incredible healthcare executive and social entrepreneur and visionary, and she is literally dedicated her time and her career to transforming how care is delivered to seniors at home. So she founded Houseworks more than 20 years ago, I think 25 years ago, and really took an entrepreneurial approach to growth. And that's how they built this, one of the largest agencies in the country. But beyond that, Andrea's individual accomplishments are numerous. She helped conceptualize sports center rounds for the home care industry. She was involved with she played a strategic role in the launch of the National Village movement, partnering with Beacon Hill Village and the VTV network. She was part of starting more than a dozen villages nationwide. She's been a formal advisor to a number of companies like Care.com and Rendever, but she's also been an informal advisor to a number of companies like mine. She has been widely recognized for her expertise through awards from her alma mater, from the Greater Boston Chamber of Commerce. She's on the board of the Home Care Association of America and on the board of the Caregiver Action Network. I am thrilled that Andrea has joined us today and is willing to share with us a little bit about her journey addressing vaccine hesitancy at Houseworks. And so the nature of our interaction today will be a dialogue. So I'm going to stop sharing, and we're going to have Andrea is in the audience. I can see her there. And we're going to have a back and forth discussion, and that will be how we, the story will unfold about how Houseworks took on this challenge. And so I want to start by just welcoming you, Andrea, to our talk today.
Thank you. I also want to say that many years ago, we had an office in Washington and Maryland, and we had joined MITCA, and really I just was really impressed with the organization, and thank you for having me, and thank you for hosting, and a lot of the villages that I helped to start out were actually in the Washington, Virginia, Maryland area. So I just spent a lot of time down there, and I have very fond memories of all the people that I met and all of the people who are running home care companies. It was just so I'm really happy to be here. So thank you.
We're really happy to have you here. And yes, we are a collective fan group for MINCA. So
yeah, really a great organization. So I don't know how you wanted to, I was just going to tell you a little bit more about Houseworks and then sort of just slide into it. As Charlene said, that we've been in business for over 20 years. I founded the company. And for those of you who have been in business for longer than 10 or 15 years, you remember that back then there were no recruitment issues, no retention issues. I mean, it was just, there were a lot of other issues, but those weren't the issues. But even back then, as a new company, we were one of the first independent companies to spring up in the country. And right now, our biggest sort of market is in Boston, but we have smaller offices in Philadelphia and in New Hampshire and Southern Maine, and we are continuing to grow. I'd say we have about 300-ish caregivers in Boston and about 100 in each additional site that we're in. But about 13,000 hours a week in Boston, and our average. We've had people that have been with us since the company started for 20 years ago, but our average rate is about a little over 4 years that people stay with us. So we have a pretty good retention rate. We've got a lot of people that have stayed with us between 5 and 15 years. And I say that because one of the things that I just wanted to say right off the bat was we are talking about vaccine hesitancy here, but I think it's really important to understand that, when I saw vaccine hesitancy and I ran, with Charlene, the sort of vaccine hesitancy for the company, I took on most of what it took because I realized how important it was. When I look at it now and I think about all the time and energy we spend and we're still spending on it, I really see it as, everybody's getting on webinars to talk about caregiver engagement and retention. And, vaccine hesitancy, if you do it right, can really support any efforts you're doing on retention and on engagement when you hear more about our model. The other thing that I wanted to mention about Houseworks before we go any further is that we also do a lot of work in senior housing. It was over 50% of our work is in senior housing. So with vaccines that, I don't know how many of you actually spend a lot of time in senior housing. And so, it was when it came to testing and vaccine hesitancy, the senior housing sometimes is a different animal than in terms of what they required around vaccines and around testing than sort of if you were dealing with families in the community. So about 50% of our people do live in senior housing in Boston. So I want to make sure I told you that. There's not even a chronology, but it's, by the time the vaccine came around, we were almost a year into just the pandemic. And for all of you who were running home care companies during the pandemic, you knew that sort of things were coming at you fast and furious. You didn't know what the next day was going to bring. It was just, slightly reactive as much as you try to have a plan. And, I think for a lot of us, because we're really not through it yet, because we're dealing with all this vaccination, we're dealing with all the variants now, we're dealing with still anxious family members. I don't think we've realized what an impact it's had on us or our caregivers, and we haven't really breathed through that yet. So I appreciate that, and I appreciate all of you who are still doing all that work to sort of keep us going. But while we were dealing with the pandemic, we were, there was, as for us, and I don't know how it works in Maryland, but for us, we had to decide whether or not we were actually going to see COVID positive patients. And, that was a big decision. I was clear with my team that I wanted to, so that, that was a whole nother layer of work that we had to do. And in order to do that, you really have to sort of start. We always felt like we were a company that tried to build trust with our caregivers, but like the pandemic, it was just like, you really had to figure out, you just really had to think all the time about what it felt like to build trust and how to do that and what's the best way to do that. And for us, part of what we had done before the pandemic, although it sort of switched a little bit, was we put into place a layer of what we call a caregiver engagement specialist, because we realized that, we have schedulers, we have case managers, we don't have nurses, but a lot of you have nurses because by regulation. But there was always this, who does the caregiver report to? Who's the first person the caregiver reaches out to? All of that. So for lots of reasons that I'm not going to get into now, we put together what we call this layer of caregiver engagement specialists. And when we keep going on and talking about the vaccine champions, the caregiver engagement specialists were really the people that we look to help us with vaccine hesitancy. But in terms of what they really did, I can give you the jargon for it, but really, they were there to, and all of you have this onboarding process, and, like we wanted one consistent person or people there that the caregivers could trust and rely on and ask questions, and were there for them all the time. And that's what these folks did. They were also, if something went wrong on a case, the caregiver engagement specialist went out and would meet with the caregiver and talk with the family a little bit at a little bit different level than the case manager in our mind would do. It was just at the level of caregiver to caregiver, peer-to-peer support. So there was lots of things that the caregiver engagement specialist did. And part of it was even just advising the schedulers on who to put on a case, because they know them better than anybody, because we were a pretty big company in Boston. And in the beginning, when I founded the company and we were smaller, we sort of knew every caregiver. So when you don't know every caregiver, it almost forces you to put this layer in place. You guys might have different ways to keep track and monitor and know your caregiver. So when you're doing a match, you can match them better. But for us, we felt like we were losing track of that, and we wanted to do that better. So these caregiver engagement specialists really helped us do that. And they're like, they sort of bridge the gap between the caregivers and the office. We found that they were really the first person that the caregivers reached out to after their orientation. And then the caregiver engagement specialists sort of report into us and sort of tell us what's going on. And the other thing that we've been told is that these caregiver engagement specialists, they would get these caregivers to sort of open up and tell us what's going on in their life. So we would understand sort of the emotion of what's going on in their life. And if something happened on a case or they didn't show up, we would have a better understanding of why it happened. And that was really important to us. So if you think about what we did before the pandemic, and we took that model, and we saw these folks, and and then the whole idea, the vaccine started coming out and the clients started calling us. It's like, and, probably like many of you, there are, a small subset of caregivers who just immediately went and got the vaccine. Some of them, it was easier for, because if they were reporting into cases in senior housing, the senior housing people had the vaccine right there. It wasn't so easy. We created relationships with hospitals like Boston Medical Center, which is a Boston hospital for underserved, vulnerable populations. We had a really nice relationship with them where we could actually call and make appointments for vaccines for caregivers, and that really helped us at first. So, and so we had, the small, and then the undecided, which was, probably 70% of the folks that, and then those who just said absolutely not. So, so it wasn't easy to get this done. And it's like, okay, we have to have a response. We have to figure it out. And, how should we do this? And you don't really, it was sort of felt like, when I started the business 25 years ago, there were absolutely no benchmarks. There was no other companies like ours. You didn't know really what to do. You just did it. So we sort of spent a lot of time just on the fly figuring it out. And then I got introduced to Charlene, and that was a godsend in the sense of just having another person who actually knew more about the vaccine and the science behind it, plus knew about caregivers and public health. So that was a big help to us, to find an expert that can help you, whether it be someone that's maybe on your team, if any of you have medical officers, or, anybody. But that helped me, because I was in uncharted territory, which I'm used to being in. But, in a pandemic and what we're dealing with in life and death and the whole industry, everybody calls private home care non-medical. We're very medical, in fact, and we do a lot of work, right through hospice and when people die. But it did really change the stakes a little bit. The whole, everything that we had to do became a little bit harder for us. I'm going to stop there, Charlene, see if you had a question. I can just keep going on, but I want to make sure I'm directing it in the way you want me to.
No, you're doing fabulous. I was going to ask you questions that took us through the chronology, but you're actually already doing that. So just continue.
Okay, perfect. Then I'll just keep, and then at the end, we're going to have questions and answers, right? Because I want to be able to answer people's specific questions if they have them. So, so in terms of our response, my feeling is that how do you get these folks who are sort of in between? What's the root cause of why folks are hesitant? And and that's again where Charlene helped. But I also started talking to our caregiver engagement specialists, and the root cause was much about they just didn't have the right information. They're getting third-hand information. They were listening to other people. There wasn't anybody sort of telling them. They didn't know how to, they'd never done something like this before where they had to research something, or they had preconceived notions about the vaccine. Everybody knows sort of the major factors of why people were hesitant. It happens by, there's consistency, and then there's, and there's this one-on-one. I mean, you gotta like customize it in a sense. And we were lucky enough to be able to do that because we had these caregiver engagement specialists kind of teed up to do it. So I started talking to them. And then we also had to figure out, I mean, they were doing other things. So then vaccine hesitancy became a lot of what they did while we were really at the point when the vaccine became accessible. And, from a business perspective, you got to think long and hard about what they're not doing in order to do vaccine hesitancy. And there was definitely talk from our senior team about, is this what we want them to be doing, and how long can this happen? And that's just a sidebar, but I didn't want to just not say that because that was something that came up. But so we realized that the best way to do this is to figure out a way to do this. So we were also testing, and we did testing in a lot of different ways. At the end of the day, we started doing weekly mandatory testing. That's a whole nother topic that I'm not going to get into now because that would take up way too much time. Like, why are you doing that? We went from bordering on no testing to weekly mandatory testing. But basically what that allowed us to do, these weekly mandatory tests, is to have a touch point. So the vaccine hesitant, so we took 2 of our caregiver engagement specialists. We had 4 at the time. And 2 of them hadn't been vaccinated, and they refused to get vaccinated. But by the time we were done through this process, they both became vaccinated. So that tells you something. So part of our touch point was, meet them at the testing site and hand them information and talk to them, and talk to these caregivers about, the vaccine. And so I think, and the other thing that we did that I thought was really helpful was, again, using Charlene. We, as a doctor, she actually, it was kind of a train the trainer model. So Charlene got on the phone with mostly the 2 caregiver engagement specialists, who became the champions. And oh, by the way, we started thinking about, using social media to sort of let everybody, the caregivers know, get on their Facebook page. And I don't think that was bad to do, but I don't think that was the end all and be all. I think you have to think of things as, what's the intervention that you really are going to rely on? And then what are the ancillary things that you can do to just raise awareness? And I think that's where it was like, okay, we're going to raise awareness, but what's the intervention? And I think when you guys have thought about what you do, you might want to bucket it in sort of in that way. So, Charlene got on the phone, and you would remember the details, but it was like once or twice a week for many weeks to just teach people. We did a survey. It's like, help us understand why, what your questions are. And then basically did a train the trainer of these vaccine specialists so they could answer the caregivers' questions. And the other thing that I think is really important, and, again, you might know all of this, but maybe it's confirming, or maybe you think you thought about it, but you didn't actually do something about it. But what was also really important was that anybody who was involved in this process, from the CEO down to anybody, is that there's no judgment. There is not a question that's silly. If people, like, you always think about that term, perception is reality. So if people think that XYZ with the vaccine, then that's their thoughts. And we have to really help them understand, not convince them one way or the other, but help them understand what the facts are. And then, once they understand the facts, maybe talk it through with them. Our caregiver engagement specialist told us that it wasn't one call. The interventions were calls from the caregiver. Either they met them at the testing center, or they would call them up, or they would actually be seeing them in the field. It took between 1 and 8 times for the hesitant ones to get from hesitant to get the vaccine. So think about that. That was a lot. And basically what Vinette, who is one of the people you're going to meet tomorrow, she told us, she wouldn't get on the phone and say, let's talk about the vaccine. She would get on the phone and say, how you doing? How are your kids? What's going on? How are your cases? How are the clients? And then it might, have you thought more about the vaccine? So you have to go through a conversation. You can't just get right into it. You have to kind of meet them where they are, because if they're hesitant, that's not, again, it's continuing to build trust. So, after, and this was really helpful because, afterwards, I didn't really exactly know what the interventions were. I didn't know it took 8 times. It was just kind of happening. But afterwards, I found out how it happened. So I'm hoping that some of what we learned can be helpful to all of you as you sort of think through, is there one small thing that I can do? Is there something that I can add to it? I just, right before I got on this webinar, I got an email from a friend of mine who runs a home care company in New York, and he said 38%, I think he was using, of vaccinated caregivers. He's like, I don't know if this is a Northeast problem, how are you guys doing? Where there's a group of us that all have large home care companies across the country. And we've been sort of talking about this, but, and the other thing that is interesting to me, I don't know how many of you, well, some of you might be straddling at least 3 states, but, our New Hampshire office, well, the caregivers up there are much less willing to get vaccinated, and our Pennsylvania office, which is in Philadelphia, they're much less willing to get vaccinated than Boston. I'm not sure, again, if we're doing it as well down there, or if it's regional, honestly. So and I'm going to try to pick at that a little bit, but I just sort of found that out when I was thinking about it. Right now, one of the things that Charlene had asked me when we were preparing for this was, we are not requiring people to get vaccines. I really don't want to do that, unless I just don't want to do that. Now, for them to go into some senior housing, they are required. Like, so there are folks that are required because they're in senior housing, and either they have to get the vaccine, or they just, we'd have to put a different caregiver in there, because that's just part of what they require from us. But we're not requiring people to get the vaccine, and we're not hiring people who are only vaccinated. That was another question. So we are hiring people who are not vaccinated, but in the onboarding process, we are talking to them about getting a vaccination, and are they willing to think about it? And, because then we would know better. We also, when in terms of the vaccination process, we do keep a record of it in, just to know whether they're vaccinated or not, because we are getting a lot of clients, and I'm assuming everybody is, that just want a vaccinated caregiver in their house. And because some of you might not be private pay, we're all private pay, and no Medicaid, even no Medicaid private, just private pay and long-term care insurance. So it's either out of pocket or long-term care insurance. So, if a client says that they only want a vaccinated caregiver, they're paying for it. So we have to figure that out for them. We do try to tell them, we have talking points for them to tell them that, PPE, it's safe. We have all of our talking points, or we might be able to say, we can't find a vaccinated caregiver, and here's who we can send, and we can assure you that they will be wearing and they get tested, and et cetera, et cetera. But the customer does have the choice to be able to choose that. One of the things I also wanted to mention was, and I did, because we have nurses in New Hampshire. We do not have a nurse in Boston. We have a nurse in Philly. I of course at first thought the nurse would be the person that the caregivers could turn to, and that's actually not true. So like, I think a lot of companies thought in the beginning that okay, well, I'll assign the nurse to this project of vaccine hesitancy, and sometimes the nurse isn't the right person. So that was just one of the assumptions that I made that turned out not to be true. And sometimes it's the scheduler, sometimes it's, and it's also just like, you also have to think about time, because I don't know about for you, but for us, running a home care company and getting it all done during a pandemic took a lot of time. And, most of us are pretty lean in terms of the amount of staff that we have. So you also have to make room for this. And that isn't always easy to do. But so I did want to mention that, we did start making the badges and start, we did do some of that. I just don't know how much of that worked. We talked a little bit about that before. So I think I pretty much covered most of like what I wanted to make sure that I got out there, and, now be helpful for you to just go through any questions you might have, Charlene, before we open it up.
Oh, absolutely. Thank you for that great summary of how you approached vaccine hesitancy over the last couple of months. I'd love for you to spend some time talking about the decision, the leadership decision to focus on this. And you said that there was some discussions about, the baseline workload of the caregiver engagement specialists, and the decision to enable them to divert some of their time to this. What were they doing at baseline, and how did those conversations evolve?
So, again, I think the whole pandemic, everybody's leadership team, or even if you have, you have one or two other people, and the three of you, I don't know who's on the call in terms of what level you are at the organization, but everybody's, there was this, there was this thing where, like, during the pandemic, like, at first we didn't know how bad it would be, and then it just kept getting worse. And then it's like, do you serve COVID positive patients? And then, so I realized as the CEO of the company that I was going to have to make this a priority, because otherwise it would be like, okay, well, let's get people vaccinated, and, we should track it. And, but if I hadn't done that, people were so sort of strung out on everything else that they had to do. So I feel like in everybody's company, there needed to be one person who just said, who was at a pretty high level. It also like shows well that if you get the senior team involved in saying, we really, really, really want to support you on this. I think we got feedback from not only the caregiver engagement specialists, and frankly, that's a really important position to us, and it's really hard to find caregiver engagement specialists. Most of them were caregivers. We sent them to school for management training. It's not that, every caregiver says they want some sort of a career path, but not every one of them is right for every job, and some of them don't even understand what the job may be. So it's just not an easy position to fill. So we wanted to keep them engaged and happy too. I had a conversation as, and I'm talking like as a leader to Vinette, and I said, and I said to her, boy, this is a really cool time in the company, because you can do this much better than I can do this. You as the caregiver engagement specialist can lead these caregivers and this project way more effectively than I can. And, she probably knew that anyway, but to hear me say it, because she's like pretty savvy, that's what I love about her. She probably knew that anyway, but like the fact that I acknowledged that she would be better at it than I would, I think went a long way. So I think as a leader, you're looking for how do you sort of garner that support from your senior team, or how do you get your senior team to come out and talk about it? And then at each layer of the organization, you have to figure out how to sort of disseminate it. But you also have to make sure that everybody in the company is behind you on this, you know? And as I said when I started the conversation, I feel like us as a company, Houseworks, you know, showing as much attention as we did to this problem, I hope made the caregivers who were going out there in the field when we were sitting in our houses, you know, for the most part, for those 3 really difficult months last year, that, you know, like, I hope it showed them that, you know, we're trying to create a safe space for them. And I think that's really important that we create, you know, we as people running the company, however you can interpret that in your own companies and however you want to talk about it. You know, again, Charlene and I, we talked about having a town hall and getting people together, and then, you know, we didn't do that either, really, because how are you going to get these people together? You know, we're going to do it 4 different times for 4 different shifts. Most of them probably wouldn't have wanted to do it. So, you know, the other thing that we did was we turned it around to make it their time, like make it convenient for them. You know, we would have done anything to make it convenient for them to do the vaccine hesitancy piece of it, which frankly, I again say in terms of retention and engagement of caregivers in general, as home care operators, we have to learn how to make it, you know, on the caregiver's terms, because that's how hard it is to get people. And, you know, as an advocate of home care, of professional caregivers for the past 20 years, as hard as that can be in some ways, yahoo. I mean, it's about time that, you know, if the pandemic did anything, it helped us professionalize caregiving and help people understand how important it is for us to do that. And I feel really good about that as an advocate for caregivers and just professional caregivers that have chosen this. So I think, you know, as a leader, you just have to, people have to understand that there's passion, and maybe if your leader isn't so passionate about it, there's someone in the organization who's just out there talking about it. And you know, and so there were some hard conversations, like, and with different people who didn't really want to deal with doing the extra work, you know. And if that was the case, like, this was a non-starter, we had to do it, you know what I mean? And so and for most of the people on my team and in my company, people were really, you know, supportive of wanting to be part of this process and helping it. But, you know, in any organization, there's always 1 or 2 people. And, yeah, and then it just, you know, it became one of those things that they just knew they had to do. So.
That's great. I'll ask you to talk a little bit about compensation and whether or not you compensated the caregivers and what that decision tree was like.
Yeah, I mean, we did compensate. We did compensate the caregiver engagement specialist to do the vaccine hesitancy work. We gave them a bonus for it. It was also sort of, the timing was good because they were due for raises anyway, so they got a raise and a little bit more. We elevated one from a caregiver engagement specialist to the director of caregiver engagement, and that was, you know, again, a big help, because it also helped everybody in the company to realize what an important position that is. It's not just like another layer in between the caregivers and the administrative team. They are so enormously helpful to the organization. You know, again, for those, I don't know how all of you are structured, but, you know, we all know that the schedulers are like the people who are the heartbeat of the organization. And in our organization now, it's sort of both. And I think the pandemic helped that. So yes, we did compensate them and try to give them, to try to acknowledge with some level of compensation about how important it was, because they were working. Yeah, the caregivers, we have an on-call system, but the caregivers were calling them. what should I do? Okay, Vinette, I'm ready to do it. Let's go. And, they sometimes the caregiver engagement social would actually escort them to the vaccination site if they were nervous. I mean, in senior housing, that was easy because it was generally on site, but they would do that anyway. And that was just like, what a wonderful way to help somebody. So, yes.
Thank you, Andrea. Now I'm going to spend like 2 or 3 minutes and summarize the intervention that Andrea described, and then we're going to open it to questions, and we can go as long as you want with the questions. So I'm going to share my screen again. Okay. So the first thing that Andrea mentioned was the importance of selecting trusted messengers, right? So the caregiver engagement specialists were the trusted messengers, but the reality is they were the cohort, they were the group, the individuals that the caregivers at the agency already trusted. So in terms of building trust, there had already been a lot of work done before the vaccine hesitancy work, so that group was already trusted. And as Andrea mentioned, they were already getting inquiries, and other caregivers were turning to them to seek advice about what to do about the vaccine. So they were the right messengers. But that role of the trusted messenger can be anyone. It might be, you might choose a peer-to-peer approach, you might choose your schedulers, you might be an administrator, you might be the administrative assistant. It's the trust is more important than the title, and the trust is more important than the knowledge, because you can teach anyone about the vaccine, and you can teach anyone how to address the myths and the concerns about the vaccination. And that was one of the things that we did. We really focused in on translating science to the simplest, most basic level, so that the caregiver engagement specialists actually became viewed as experts within the agency on the vaccine, and they actually were. Other steps involved in understanding the caregiver's concerns. So that's what Andrea talked about, but we actually did a deep dive interview with the caregiver engagement specialist to review all of the different topics that caregivers were asking about. And we used that to shape how we did the capacity building in step 3. So we understood what they were concerned about, and then we taught Vinette and Marcia how to address those concerns, like how to address it. So they were already trusted, so that when they were able to address the concerns, people believed them. Then the next step was actually doing the outreach. So we didn't just wait for people to reach out to Vinette and Marcia. They literally went through a list and sat by the phone and made call after call after call. And as Andrea mentioned, sometimes that was multiple calls over time. So if somebody was adamantly against the vaccine, maybe you waited a couple of weeks before calling them. If somebody was hesitant but wanted more information, was like, I didn't really want to do it, but let me ask you 5 questions. That's somebody that you can follow up within a week or 2. So it ranged, the number of times that they had to be contacted ranged, but it was one time for a minority of caregivers that were already hesitant. The 5th step was, once you actually moved somebody from hesitant to ready, then this is much less true now, but at that time there were a lot of constraints to actually getting the vaccine. So the vaccine champions actually helped to make appointments. They physically went with people to their appointments. They helped to remove constraints. Once somebody had made the mental shift from hesitant to ready to get vaccinated, they helped to make sure that that would happen. And then finally, there was the compensation step that Andrea mentioned. So those, to kind of consolidate everything that Andrea described, that was how you could break down the intervention into these 6 steps. We had talking points for the vaccine specialists, and I wanted to point you towards the COVID caregiver fact sheets that we developed for Minka. So you yourself actually have fact sheets through Minka if you choose to use them. They're online, they're available. Sarah, who's with Nonprofit Resources, who's in the back doing all the tech support, will drop those links in the chat for you. And we're also going to send out an email with resources at the end of the week. So on that note, we are going to shift gears and open the floor. Do you have questions for Andrea? If so, we're a small enough group that you can actually just unmute and maybe take off, turn on your video and just raise your hand. If you're shy, then you can let us know by raising your hand or dropping a note in the chat.
I looked at all of the chat, and a number of people had gotten to a certain point of 70%, and then I want some creative ways to get more. And I would imagine that there's probably a lot of people are doing that. So, I don't know, Charlene, do we have any words of wisdom around, that last 30%? I mean, we're still just, I actually think I'd love to hear people's feedback on that, because I sort of, or what have you done? It's like anything in home care. There's not one magic bullet that's going to help you, get caregivers. There's not one, there's not ever one magic bullet. I think that, like maybe the best way to just, like, I think part of it's in the framing where you say, so for July, I'm going to do this, for August, I'm going to do this, maybe it's take it month by month and sort of, and then watch it creep up. And, I think that could be some of it, and Charlene and I have had a lot of conversations about, saying you're not going to be able to work for the company anymore if you don't get vaccinated, or trying to say, well, everybody's asking for a vaccinated caregiver, so you better get vaccinated. Like, we're trying our best not to be punitive about it. And my vision would never to be punitive about it, but I think, there's ways that you can, maybe every month you come up with something where we're at 70% now, let's get to 72%. Maybe it's a contest. Some companies have talked about, compensating people to get vaccinated, which we have stayed away from, but maybe you can put, make it a contest, or, do something around it, and with a month by month goal to be able to get to a certain point, and everybody wins something at the end, or you do a company picnic at the end if you can get to, I don't know, but I'd love to hear, if anybody has any ideas. But I've been trying to think about it too, because it's always those like when you're trying to lose weight, it's those last 10 pounds, right? I feel like it's just like, this is the last, and you just really just want it to happen. But you have to keep, the one the takeaway that you've heard over and over again is about consistency. So you have to be consistent at it. So that's why I personally like a month-to-month plan.
Well, thank you, Andrea. Nicole Savoy has a question for you. So just go ahead and unmute yourself, and if you feel comfortable showing us your face, that's great. If not, we'll be able to hear you.
She might be having a bad day and doesn't want to show us her face. I'll probably stop my video because I think my picture's better than my face.
Okay, Nicole, the floor is yours.
Well, good afternoon, and thank you just for having this. I was just, I had a short meeting with my supervisor just before this meeting, and we were talking about the different reasons why people were experiencing hesitancy. And our agency works with individuals with disabilities. So a lot of the community that we serve have caregiver support. And so we're just, trying to strategize a way to either encourage the individuals to talk to their caregivers, or, find ways that we can reach those caregivers that support the people that we support. And we were just wondering, different ways on how to reach those caregivers. I was in another webinar hosted by Georgia Tech, and a lot of the presenters themselves even said that they had some vaccine hesitancy, and we were trying to see, if there were certain pockets or core reasons that a group of people that could get around why they were experiencing hesitancy. So have either of you identified core reasons and have done outreach to address those reasons. Like, for example, some of the presenters at the Georgia Tech webinar were explaining that there was some cultural hesitancy, especially in people of color. And I know it, at least in the Maryland, DC area, quite a few home caregivers are people of color. So have either of you experienced that, some of the cultural, historical backgrounds for vaccine hesitancy, and has there been any outreach to talk on those points specifically?
Yeah, Charlene, do you want to? I think you should take that one because you really poked and prodded it up for us. But yeah, a lot, in fact. And I think, do you want to start and I can finish?
Absolutely. So Nicole, thanks for asking that question. You're correct. In the Maryland, in the DMV, so DC, Maryland, Virginia area, the majority of caregivers in most parts of Maryland are actually Black, either African American or of African, part of the African diaspora. Similarly, in Massachusetts, I know that Houseworks has a lot of Haitian and Ugandan caregivers, and so there definitely were concerns about the vaccine that had to do with concerns about exploitation, racial exploitation. So when we did the deep dive into looking at some of the reasons for hesitancy, there were concerns about depopulation, so that the vaccine was part of an effort to depopulate Black people. There were concerns that at the vaccine sites, there was an organized effort to make sure that Black people got the real vaccine and that white people were getting the placebo, so they would be safe. It was all part of a big ruse to give this toxic substance to Black people, to remove Black people from the earth. There were concerns about this new world order where there's these influential people are coming together, again, as part of this depopulation strategy. And so, when you take a step back from all of these concerns, believe it or not, they make a ton of sense, right? Like there's, if you think about, I spent 9 years of my career in global health. And so I worked for the US Agency for International Development, traveling around the world. And for decades, US governments, other governments have spent billions of dollars on reproductive health interventions in low middle income countries around the world. Many of them were making Depo-Provera available to women to prevent pregnancy, right? And so Depo-Provera is an injection. It was an organized effort to give women an injection to make sure they did not populate the earth. And if you ask Mike, I'm also from an immigrant family, and if you ask my uncle today, he still thinks USAID was trying to keep Black people from having babies when they came with their injections in the 70s. And so, like, it might sound ridiculous, like depopulate the earth, what are you talking about? But actually, when you think about the number of African immigrants in the caregiver workforce, and you look at the history of the things that we've done, it's not, a lot of people like to point to Tuskegee, but it wasn't that long ago that we were doing some pretty sketchy AIDS research and when I say not that long ago, I mean like in this century, in parts of, I think, Tanzania. Like we have such a history of, like we have such a history of questionable interventions that when we come along with something that is not questionable, it makes sense that people question it. So what we did with the caregiver engagement specialists who were serving as vaccine champions, we actually literally, so the talking points, maybe I'll share my screen to show them. The talking points literally go through these types of questions. Like, is this an effort to depopulate the earth? Are they experimenting on me? Will this mess up my DNA? Lots of questions about pregnancy, Bill Gates. We heard that influential people created the vaccine to control us and begin a new world order. So we have this fact sheet, but we didn't just hand out fact sheets to caregivers. What we did was I spent time with the caregiver engagement specialists, and we talked about why people were worried. We gave them the tools to have real conversations that were based in respect for the ideas. Even though the ideas were wrong, there was no judgment. And so by taking people who are trusted and then creating space for people to share their concerns, even if you and I may perceive them as outlandish, they're not actually outlandish, they're rational in the context that they're coming from. And so we addressed them head on. We didn't sort of have like a big talk on like all the reasons why the vaccine is good. It was a customized, individualized approach. The vaccine champions didn't go out and say, why don't you want the vaccine? Why don't you want the vaccine? People told them. They were already trusted. So people were coming to them anyway and saying, I think this is it. The depopulation thing was very popular. And so they were able to talk coherently about both the, like why that wasn't true, but not just by saying it's not true. Like it's not true. Like that's not convincing, right? They were able to contextualize why one might think it is true and why in this case it's not true. So tackling the concerns head on, but in as much as possible, a tailored way is how you'll get the attention of people. When you address their specific concerns, then you actually have the power to influence. I mean, when I worked with the vaccine champions, we even talked about the stages of behavior change and how when someone's pre-contemplative, it still has impact to share a new idea, but that you actually like take a different approach to how you communicate based on the stage of readiness the person you're talking to has around the behavior change, the health behavior change we're trying to inspire. And so I hope that answers your questions. The answer is yes, but we didn't do it as like a big talk and all the reasons Black people have crazy ideas about the vaccine. It was much more individualized and validated through respect and then invalidated through data.
Yeah, and like if you take, and I totally agree with you, Charlene, and if you take all of that and you say, okay, so now how do I do that? You know, it could be like if you're sitting down with someone who's hesitant, you know, because I was trying to visualize what that conversation would look like, regardless of who does it, we know you have to trust them. And then, you know, so tell me why, you know, tell me what's up, what is it? And then they tell you, or you could start with, well, here's what I'm hearing that people are thinking. And if some of that's what you're thinking, then they'll know you're clued into it, right? Like, so it might be even good for you to get that fact sheet and then sort of open the conversation with what's up, you know, this is what I'm hearing. Tell me, you know, is this what you're thinking? And let's talk about it. So I would use that fact sheet as a place to have the conversation so you could get a better sense. And, you know, when I heard all of what Charlene was telling us, you know, it all came down, we talked about, you know, the lack of trust. Vinette was saying that a lot of the folks that the caregivers that she was talking to, they get a lot of their information off of social media, you know, and they didn't necessarily validate the information so that, you know, like, so it's important for you to also understand they're getting their information mainly off of social media or from friends that aren't, you know, they're not going to be talking necessarily to people that are believers. They're going to be probably talking to people that aren't believers. And that's why they're still not a believer, because they're only hearing one talk track. And, you know, they think it's going to hurt them more than it's going to help them. So, you know, maybe you can say that, and there's lots of stuff out there about that. Like it's, you know, I understand that you think, but let me tell you how it's going to help them. Like take it and just, you know, go with it as much as you can and do it in small groups. So.
Thanks for that question, Nicole, and thanks, Andrea, for adding that answer.
Thank you very much.
Sure. Other thoughts, concerns, success stories or challenges that you'd like to share and get feedback not only from us but from your peers. This is a chance to talk to an audience that cares very much about the same things that you do.
Hi, my name's Ardella with Premier Home Care in Maryland. We have a lot of our numbers are starting to come in. We've been asking repetitively, hey, send your card, you know, and as Andrea says, you know, all those blasts, you know, it's like they fall on deaf ears, you know, if you catch them in the Title, subject line, maybe, but what we've done, we've taken the remaining ones that we do not have a card, and we just divided it up, between our staff. Premier internal staff is pretty small. And we just did, I call it dialing for dollars, reaching out, trying to make that contact, and again, as Andrea says, you can leave them voicemail messages. Do they really call you back? No, and stuff. So it's hard to get a hold of them. But, we started that at the beginning of the week. And just by getting cards back, we've gone from 70% to 75%. And I still have 3 staff members that need to get numbers back to me. So I'm hoping that we actually might hit 80%. And then we have to tackle the no's. Why? I do see that caregivers that are pregnant are a hard no. They are not going to be having it during, pregnancy, which, hey, I can understand, because even though there's no real science that says differently, a lot of times things like that don't manifest for years down the road. So, you can't push back on that too hard. But, Charlene, if you've got any comments in regards to that, I think fertility and being pregnant is a big drawback.
Well, the good news is that there's not only evidence that it's not likely to harm your baby, but there's actually evidence that it's likely to help.
What is it, vitamins?
No, it's antibodies, right? Like there's
Oh, right.
might actually offer a protective effect to your infant. Like it's actually, everything that's come in so far is extremely, it's not just like, oh, it doesn't hurt you. It's more like, whoo, it helps you so much. Ardella, if you email me, I don't know, were you on the email chain I sent out earlier? Oh, you're on the, regardless, I'll put my email in the chat, or just contact Minka and you'll be able to get in touch with me.
Yeah, Dawn has my email, but I'll send it to Dawn and just ask her to push it down to you.
Yeah, I'm happy to share a couple of resources.
That'd be awesome.
Help, but also there's a lot of more recent information that's very promising. And so I actually, the 2 specialists that Andrea mentioned that were not willing to get vaccinated at the beginning, their reasons were concerns about fertility. And one thing that was compelling, this was months ago, was that there were thousands and thousands of women in the trial, and you weren't in the initial trials, you weren't allowed to be pregnant at the time you enrolled, but that doesn't keep people from getting pregnant. So they're like, even in 2020, there were all these babies born to women who have been vaccinated in the clinical trials because they happened to get pregnant.
Okay.
During the clinical trials. And then subsequent to that, as of a couple months ago, there were like tens of thousands of pregnancies being tracked by CDC. Like there's a lot of positive information out there about pregnancy and fertility. If I were pregnant, I would race to get the vaccine because of the benefits as opposed to fears about the harm.
Right. But, it just, as someone had mentioned, I don't know if it was Andrea or something, but, in the DMV area, our caregivers are of color, hands down 95% probably. And a lot, then you have a lot of them that, people weren't born here. And so, what they've experienced in their country, how vaccines were rolled out, et cetera, that also makes them hesitant. So you couple everything, and then all that crazy stuff they read on the internet or in chat groups, you're just like, oh my gosh,
Well, who do they trust? So the key would be
Yep.
figuring out who they trust, right? So I spoke to someone at one agency who said that there were 6 caregivers at her agency that all went to the same church. And at that church, the pastor was saying that men should be vaccinated, but the vaccine wasn't meant for women. So all 6 caregivers were not willing to be vaccinated because their trusted messenger, their pastor, had told them not to.
Right.
So you find someone else it's hard to unearth the impact of someone who's trusted, who's giving false information, without having someone who's trusted giving correct information. So I would dig deep and figure out not just it sounds like you guys are working really hard and doing the phone outreach, which is amazing. I would like file through your team and figure out who's most trusted, like the most trusted. And then I'd set aside some time for that person to do the outreach to the ones who are worried about pregnancy, and make sure that that person has all of the updated information about pregnancy and the vaccine, so that they'll be ready for any question.
Okay.
They're already trusted. That would be one approach you could try.
Yeah, and I think another one is, well, no one from my ethnicity or my color or have were participated in the trial. Yeah, that's another one. Kickback.
You could check the fact sheets. We actually put some numbers in there, and so
Okay.
yeah, the majority. What was interesting is that the majority of trial participants were white. So all of the initial concerns about how it's this experiment on Black people, it was an experiment on white people. And so that it was. I mean, it was like, I think 80-90% white participants, but there were definitely, I think, up to 10%. The numbers are available in terms of what percentage of participants were from different backgrounds, and it doesn't really matter who was in the trials because over 1 billion people have gotten the vaccine. So like the biggest trial is the rollout to the world and the 1-point-something billion people that have been vaccinated. I think that also may help. But not everybody's going to be convinced, but I do think there's increasing data that can help. And if you, it sounds like a targeted approach to debunking specific myths might help you get from that 75 to 100.
Yep. Yeah. Okay. Thank you.
You're welcome. Other questions? Other hands up? Anybody else?
Everybody's got the problem solved.
Okay, well, if there are no other questions, I guess I'll invite, wait, is Risa still there? Risa, you put in the chat that you've gotten to 75%. So do you have any tips to share with the audience?
Yes, hi.
Hi, Risa.
Can you hear me?
Yes.
Yeah.
Okay. Yeah, I mean, we just really have been beating the drum on this for months, since January. And we keep kind of refocusing and re-establishing what we're going to do next. So, at first when, this was mentioned before, but it was so hard to just even find an appointment. We concentrated on that, how to get them information about where to get appointments, how to get appointments, telling them not to worry if you can't get one now, they'll open up later. Then as things opened up, we, started saying, okay, now it's easier to get an appointment. When the state-run vaccine clinics started opening up, every time something came up that we thought caregivers would be interested in, we sent that out. So there was a walk-in clinic at the Greenbelt Metro Station here in Maryland. That seemed like a great opportunity for caregivers. So we sent that information out right away. So just like my job was really just keeping on top. Every morning I went online and I looked at what was going on in terms of vaccines and just tried to get that information to caregivers as quickly as possible, so that they always had the right information at their fingertips. And then recently, so we have about 1,300 some caregivers that work with our organization. We've got about 1,000 now who have been vaccinated. So we're just like trying to get to the end. But recently what we've been doing is we have a campaign and we call it, it's easy, it works, it's time. And we're saying like, it's as easy as it's ever been to get a vaccine. You can basically just like walk in anywhere and get one. We tell them how to go, find one online or just go to their local pharmacy. We give them information from the CDC about how it works. We have a video also that we made that with other caregivers who already got the vaccine, who are advocating for their fellow caregivers to get it, and some other videos that we found that have been helpful. So just like that education section. And then we say it's time because a lot of the clients and the senior living communities where caregivers are working are starting to require that caregivers be vaccinated in order to work there. We've got some like hard deadlines from senior living communities that say, you know, by July 31st, anyone that enters our doors needs to be vaccinated. And then we also have clients that are just saying, I only want to work with a vaccinated caregiver. So we're letting them know that, and, you know, letting them know that in order to be open to more work opportunities, they're gonna, you know, want to have the vaccination.
That's good.
Thank you, Risa, for sharing all of that context. It's really helpful. What I'm going to do now is I'm going to shift gears and share my screen, and we're going to go through the 5 C's of vaccine hesitancy. And I think it's going to be interesting, given the conversations that we've just had, for you to, as we're talking, to think about the types of interventions that you've been trying and where they fit on the spectrum of the 5 C's. So what are these 5 C's of vaccine hesitancy? I mean, I'll skip over the definitions of vaccine hesitancy. We all know that vaccine hesitancy is a continuum, right? Because you have some people who probably were lining up before the vaccine was even available. And then you have people who probably get angry every time you mention the vaccine. But the 5 C's: confidence, complacency, constraints, calculation, and collective responsibility. Let's walk through them very quickly. This was a model proposed by Caroline Betch for explaining hesitancy among parents in the context of childhood vaccination back in 2018, so even before the pandemic. But this model is widely used in vaccine circles and has been applied quite frequently to the COVID vaccination and the hesitancy around it. So the first one is confidence, right? So this question of, does it work? Is it safe? Does the system work? Am I going to get the right vaccine? Like, confidence is almost a precursor to all of the remaining 4 C's. And the types of things that we've talked about, people being worried that it's going to harm their baby, people being worried that that it's all part of a plot to depopulate the earth, like it doesn't work, it's not going to work in me, it's going to hurt me. All of those concerns demonstrate a lack of confidence in the vaccine. So when you hear about people talking about increasing vaccine confidence, it's because you're trying to get to a point where people believe that the vaccine works, believe that the vaccine isn't going to hurt them or is unlikely to hurt them. And most efforts around hesitancy are focused on confidence, building confidence. Lack of confidence. I think Ardella asked about some of the concerns that came up. These are some of the concerns that came up when we interviewed the engagement specialists about what they were hearing from caregivers. And we've talked about many of these during the Q&A. Next is complacency. They're the people who are like, you know, whatever will be, I'm not at risk. Who needs a vaccine? It's not that bad. I know someone who had COVID, they didn't even have any symptoms. I'm not worried. Like that complacent category, those are people who don't see themselves as being at risk of COVID, so why do I need a vaccine, right? Then you have the constraints. Now this, a couple of you, I think Risa, you talked about this. So when you actually have caregivers who are confident, caregivers who've made the switch and they're like, okay, I'm ready, but wait, I can't figure out how to get the vaccine. Removing constraints. So think of the interventions, right? You can build confidence to address the confidence one. For complacency, you can help people to assess their own risk differently. When you're thinking about constraints, people feel overwhelmed by figuring out how to get the vaccine, or they're afraid to go by themselves. These are people that you can help by removing constraints or intervening to help them get an appointment or hold their hand when they're getting vaccinated, providing transportation. During one of the earlier workshops, somebody described literally taking 10 caregivers in her car and driving them to their vaccination appointments. And then there's calculation, right? Like there's this, every individual, all the time, we're weighing the pros and cons. We're trying to figure out, well, you know, I think you described this, Ardella, you know, I want to have a baby And while I know that COVID is out there and it might hurt me, I think the vaccine might hurt my baby more. And so I'm going to weigh the pros and cons in a way that leads me away from vaccination. Well, this is where you can help people to reevaluate the relative risk of different things. So the risk of COVID during pregnancy is extraordinary. It's terrible. The risk of the vaccine during pregnancy, it actually is helpful. And helping people to reassess and recalculate their risks is another point of potential intervention around vaccine hesitancy. And then finally, this sense of collective responsibility. Now, wouldn't it be great if every caregiver was like, I will get vaccinated to protect my clients? That would be lovely. That's not necessarily going to be the first priority of your caregivers, but they will get vaccinated to protect their family. One of the things that was compelling for some of the people who were hesitant that later decided to get vaccinated was once they kind of started to believe that maybe it wasn't going to limit their fertility, then kind of like everyone knows that the vaccine hurt older adults. Sorry, everyone knows that COVID hurt older adults more than other groups. But we went through some of the data, and the mortality data for older adults was so stark that I can think of two caregivers who live with their older adult parents who made the choice to get vaccinated once they kind of understood not just that it was bad for older adults, but just how bad it was for older adults. Regardless, the 5 C's are a model that you can use in whatever way it makes sense for you as you think about how you want to interrupt and intervene so as to increase uptake of the vaccine. I personally love that model. And so we have about 7 minutes left in today's webinar, so today's workshop. I'm going to pause again and invite Andrea, after the question and answer, after the conversation, after reviewing the 5 C's, do you have any closing thoughts that you want to share with this group that is working so hard to improve vaccine hesitancy and address vaccine confidence?
Yeah, I think I just have to go to the sort of support. We, in Massachusetts, we have what we call the Home Care Alliance, which is similar to what you guys have down here. And every Friday through the pandemic, every other week, there was about this number. Sometimes there was more, sometimes a little less. And, when we really supported each other, and I just want to just tell you what incredible work you're all doing. And even though you might not realize it now and you haven't had a chance to take that breath of, oh my God, that was, I just, what we collectively as an industry are doing for the world right now is really huge. And just, I don't know what it's like up there today, but here it's like one of those picture perfect, no humidity days, and just take a breath and just, realize all that you're doing. Because honestly, it's like I always use that analogy of when you're in the airplane and you put the mask on yourself before you help your kid, which always seems like so foreign to those of us who have kids. You're like, oh my God. Like I sometimes feel like, we as caregivers for everybody don't ever do anything for ourselves. And, and it's, so that's really where I want to leave it, because, and I think that there's no one right answer. And it's just, and I think just having forums like this, and maybe you guys get back together again in another month and sort of see, but just don't let up the sort of camaraderie that you have as a group in this organization in order to keep on this, because it's going to be with us for a while. And, like somebody said, I don't know if it was Risa or whoever said, it's just like, it's really important. You just keep trying you just keep trying different things. And that takes a lot of energy. There's no coasting, right? There's not any coasting now. And you just got through this hard thing, and you kind of want to take a little time. It's the summer and coast through it. And then, there's this other variant that's scaring the heck out of everybody. And you're just like, whoa, so I just want to say thank you for letting me come and be part of this, because it always sort of lifts me up. I started out my day, sort of feeling and I just feel very lifted up from just talking to you guys and, being with you. So thank you.